Infection prevention is pivotal in endoscopy. It must be approached from a holistic perspective to increase confidence in the reprocessing outcome and to minimize the risk of infection. In practice, the endoscopic field is developing much more quickly than the local and global guidelines currently in place to safeguard medical device hygiene.
We have become aware now recently, in the past few years, that it's more and more important. We have learned from many outbreaks around the world that this is a true problem. It affects patients.
On the 24th of November, experts in endoscopy gathered for a panel discussion organised by PENTAX Medical to discuss the importance of hygiene in endoscopy and ways to enhance endoscopy hygiene guidelines for improved patient outcomes.
Ladies and gentlemen, welcome to PENTAX Medical's online event, Enhancing Endoscopy Hygiene Guidelines for Improved Patient Outcomes.
How many minutes does it take to manually clean a duodenoscope properly? Cleaning should take 25 minutes, and the average time that spent was only 6.5 minutes.
With regard to the guidelines, I think we are in a very dynamic day and age right now, and these should not be static. I think more and more research is being performed and published with regard to the whole problem of scope contamination and patient-to-patient infection. And that means that these guidelines have to be dynamic and they have to follow the scientific knowledge that we know currently right now at this present moment.
There is a lack of knowledge or unfamiliarity with the endoscope channels, accessories and reprocessing devices.
Investing into the education of the hygiene people, the people that clean scopes, recognize them, give them recognition.
And we believe also that an investment in knowledge pays the best interest.
We ask people to come together to get the training we offer them to improve their skills, their knowledge and the safety of patients by reprocessing the endoscopes in a good way.
We have to spend time, money and efforts to do good research, and that good research will guide the guidance and the making of guidelines and will make them more acceptable to people because, you want to follow that what is scientifically valid and true.
So, endoscope drying and storage. At the end of the washing and disinfecting procedure, the possibility to use a system that dries completely the channel of the instruments and protect it from the development of biofilm. Plasma Typhon is an ultra-fast drying unit for endoscope, very easy to use. Plasma bag is a single-use device for active storage with plasma. So using those kind of device can minimize the risk of bacterial contamination through a highly effective drying mechanism for the endoscopic channels.
It's very important to minimize the risk of infection and to improve the patient safety, of course.
The PENTAX Medical Hygiene Commitment, we strongly believe that hygiene is a very, very important topic, and we strongly believe that we can work on minimize the risk of infection and to improve patient quality and patient safety in endoscopy and endoscope reprocessing.
By offering solutions like the DEC duodenoscope, single-use consumables, and the Plasma Typhoon and Plasma Bag system, PENTAX Medical provides physicians with a portfolio of reusable, semi-disposable, and single-use hygiene solutions to improve infection prevention and patient safety in endoscopy. As endoscopy is an area that is growing in terms of its importance as both a key diagnostic utility and a therapeutic intervention, the experts present at the panel discussion committed to keep advocating for evidence-based guidelines, training for reprocessing personnel, and new innovations, with patient safety as their greatest priority.
Thank you.